Hi there, my name is Jennifer Jackson. I'm an assistant professor in the Faculty of Nursing at the University of Calgary. And today I'm going to share this video about looking at quality in research. So there's going to be two portions. The first one is looking at validity and reliability in quantitative research. And then the second will be looking at rigor, trustworthiness, and other considerations in qualitative research. So as we start, just going to move things around. So we can use all types of methods and different techniques, and lots of studies can have, fancy equations and lots of numbers, but the question is, how do we know if the research is any good? And so you can see that we could have a listing online that says airy property with panoramic mountain views, lots of green space and parking, perfect for people who want privacy and independence. Sounds like a pretty good deal, but we may then end up with something that looks like this. So we have to learn to make sure that we're not taking things at face value and that we're reading research with a critical eye so that we can tell the difference between when we sound like we're getting this wonderful mountain chalet and when we're actually getting a decrepit shack. So this is where the role of appraisal comes in. So when you think about validity, reliability, rigor, and trustworthiness, you need to consider that as you're doing research, but also as you're reading research. So appraisal is where that comes in really strongly. So appraisal is how we can assess the quality of the study. And the role of appraisal is not to go through and say, this is wrong, this is wrong, this is wrong. It's a very elementary way to approach appraisal. So we have to acknowledge that research is messy and complicated, and especially when we're working in nursing, like we work with humans, and so there's always complicated things. It might be a bit more straightforward if we're working with a petri dish, but that's generally not the place that our research is found. So there's always limitations. Nothing is ever going to be perfect. But the question is, do these limitations compromise the outcome? So do any limitations in the study outweigh the potential benefit of the findings and things? So a sort of cheeky analogy I use is that if you're dating someone, you might say, you know what, I don't love that, like, you have a lot of baggage with a previous ex, but you know what, you treat me respectfully. It seems like you've moved on from that. I'm willing to keep dating you because I think it's going to be okay. And in contrast, you could be dating someone and go into their house and say, there's stacks of cash everywhere and there's guns everywhere, and I'm seeing a lot of packages of pills and white powder and things. That you might say, you know what, I'm not going to keep dating you. Like, the potential benefits are not worth the potential risks. So we're breaking up, it's over. So you want to think a bit about, like, are you going to keep dating that person, or is this a pretty significant issue? Approaching appraisal is kind of the same thing. It's like, are the issues that are happening significant enough to outweigh the potential benefits or the value of the outcomes? Or can we say, you know what, we might have to apply this with caution or take things into consideration, but actually we can go ahead. So with a lot of the research I've done, it would have been great to talk to more people or to talk to more diverse people. But, I had deadlines, I had to get things done. The money was running out. We had to just draw a line and say, this study is maybe not as comprehensive as we'd like it to be, but we did the best we could. And you know what, that's all you can do as a researcher. And there's nothing wrong with that. We can take those things into consideration and still value the research that's done. So we're looking to see, like, is this study, are the bones of it good? Is there enough here that we can use this to inform practice? We also want to think about the research paradigm. So reflecting back, there's a prior video where we've talked about this. We expect to see different kinds of things if the paradigm is empirical, interpretive, or critical. So if someone with the empirical paradigm says they controlled the environment and they ran to test multiple hypotheses, that's something we would take for, or we would take as that's a good way to approach it. If somebody with a critical paradigm says that they did things to control the environment, I'm very worried, because that does not align with the values and then the expected practices you would see in the critical paradigm. So it's important to start by identifying what paradigm is this research in. Is it quantitative or qualitative? And what would I expect to see? And then based on what I would expect to see, does that align with what's there? Now, there are a lot of like avant-garde methodologies, there's mixed methods, there's all kinds of things where we need different considerations, particularly in Indigenous research as well. That is a bit more complex than is at a graduate level competency. So for the purposes of today, we're going to focus on quantitative and qualitative and talk about that. So we have different approaches which reflect the different paradigms. So when we're talking about quantitative research, we're looking for validity and reliability, and in some cases also bias. With qualitative research, we're looking at rigor and trustworthiness. So if you see the words validity and reliability in a qualitative study, that should kind of perk up your ears that, hey, maybe this isn't quite right. Now, there is some controversy about this, and there's different authors that say different things. But for the purposes of our learning, I would say that it's a fairly safe bet that if you see validity and reliability in a qualitative study, something is a little bit wrong. So we're going to talk through the quantitative research in more detail. So we'll start with reliability. So reliability is, are the results consistent each time you measure? So you want to know that if you measure something and none of the conditions have changed, that you'll get the same result. So there's an example here with blood pressure, that if you have a healthy human and nothing had changed in the environment, if you do their blood pressure again 5 minutes after you first took it, you should expect to see something pretty similar. So that would be a measure that's reliable. So results can be reliable within one group. So if you're doing like a pre-test, post-test study, results can be reliable across different cultures, different populations, different time frames. So you'll see there's lots of examples where studies use validated and reliable tools that have been translated. So they'll take something like the Connor-Davidson resilience inventory, translate it to another language, and then test the reliability of the scale in that language to see if you're getting consistent results with a different translation. So the idea is that if we repeat over and over again, are we going to get the same measurements if we have the same conditions? So within reliability, there's different kind of subsections. And for my students, you don't need to know exactly each one of these in a lot of detail. This is here to provide you some examples. So when you are appraising a study, you can look and say, have they talked about consistency, and do I see a Cronbach's alpha reported in this paper? So depending on what type of reliability you're looking at, you should see the corresponding types of statistics that reflect that. At minimum, there should be a discussion of reliability within the study. And if you don't see that, then that is a red flag. So depending on the type of reliability they're talking about, you want to look and say, okay, they're talking about inter-rater reliability. I expect to see a Scots pie? Is that there? So this applies particularly to questionnaires, whether they be new ones that are being created or application of a questionnaire that's been used elsewhere. There's also other kinds of things that this can apply to. So like a mini mental exam or like screening tools that you might use with patients, Framingham scores, you might want to know that these are reliable. It does matter that instruments have been checked with people of different cultures and things, because we know that there can be a lot of bias and assumptions that are buried in there. For example, body mass index is a pretty reliable tool, but it's known that, you know, it's slanted in favor of kind of like a white Nordic build type of person, and that, you know, people around the world have different builds, and that might not be, you know, you might use that scale and find that someone's morbidly obese, but actually that's not really the case. It also doesn't apply for anyone who's pregnant or if you're weightlifting or that kind of thing. So even though something like body mass index is reliable, we have to be aware of those considerations that go into it. So if a tool is reliable, you don't just get a blank check to go forward, but it is something that needs to be considered in quantitative research. Also, we want to see validity in contrast with reliability. So reliability is, do we get the same measurement over and over again? Validity is, are we measuring the thing we actually want to measure? So just because a scale is reliable does not mean it is valid. Donald Trump is reliable. He is very reliable. He says the same things over and over and over again, but those things are not valid. Those things are not accurate. They do not reflect the actual nature of the world. So the idea of him saying COVID is just going to go away, for Donald Trump, that was a reliable statement, but it's not a valid one. So I make this point to demonstrate that both validity, these are tongue twisters today, both validity and reliability have to be considered, and that you can't have kind of one without the other, or having one doesn't mean the second can be taken for granted. So when we're looking at different types of validity, you can see again that there's different considerations. And so depending on exactly the type of study that you're having, there's different conversations about validity. And so what you want to do when you're appraising is say, is there a discussion of validity in this article? And if there is, what type of validity are they talking about, and what sort of things do I expect to see there? So you might have, for example, construct validity. So you might say this thing is supposed to, we expect it to measure, you know, behavior in groups. But if the people in your group know they're being watched, they might be on their best behavior. And that's something called the Hawthorne effect, when people act differently, knowing that they're being observed. So there may be factors like that, or with some of these other types of validity listed here, it can be related to things that you might be able to control and things that you might not be able to control. And so you'll see that researchers will do things to try and prevent threats to validity. So for example, if the sample size is too small, you might not be able to say that your findings are valid. So people will do a power calculation to make sure they have enough people participating in this study. They're going to get a high enough number so they can say, you know what, this isn't just normal population variability. This reflects an actual difference in this group. So you want to look for, is there a discussion of validity, and what type of validity are they talking about? And do you see some appropriate caveats or conversation around that type of validity? Also of consideration, particularly in randomized control trials, but in any kind of quantitative research, is bias. So these are things that could potentially compromise the results. So this can come both from the design, but it can also come from things that just happen. And sometimes the bias can tell you a lot about your study, even in and of itself, regardless of what the outcomes are. So for example, you can see that, again, there's different kinds of bias. What you want to look for is there a discussion of bias? Can you identify what kind of bias they're thinking about, and have they taken some steps to try and mitigate that? So for example, when we look at attrition bias, have a lot of people in one group of this study, if it's a randomized control trial and we have a control group and an intervention group, have a lot of people dropped out. So an example I can think of is in the early days of testing different types of oral medications as replacement for things like heroin in terms of addiction treatment. Initially, one of the first randomized control trials gave one group of people like an oral heroin type of equivalent, so an opioid agonist. The other group of people got placebo. And within 3 months, everybody who was in the placebo group had completely dropped out of the trial. And actually, several of the people in that group had died within the 1 year of follow-up, because the idea of going from regular heroin use to placebo was so drastic and so destabilizing that people couldn't continue with the study. And so from that point on, the trials, no one was ever given placebo anymore because it's too dangerous for people. So then it was a question of, did they get like an oral agonist or an injectable agonist? Or did they get, the chemical compound of heroin versus the chemical compound of hydromorphone, and what were the differences there? So something like that showed that even before they had the final results of this randomized control trial, that there was something very, very wrong with the assumptions that informed the research. So that would be a type of attrition bias, which meant that actually the study, there was a lot of interesting learning there, but it happened at the expense of the participants, which is a very problematic thing. So attrition bias can also come from, if you had lots of people in one group drop out, but it wasn't related to the actual intervention that you were implementing. But, if you get to the end and you started with 2 groups of 20, and in the end you have 18 people and 2 people, you can't make accurate measurements there. The study is going to be biased. So at that point, your trial is kind of toast. And so you need to publish about why is this maybe happening? And that can be really problematic. Like a large randomized control trial takes years to develop and implement. So to have something like that happen, all your work can kind of go up in flames, which is really, really difficult to deal with. But you know what? We have to have integrity in the research we do. And so we have to be aware of these types of things. So again, you want to look for a discussion of bias, and what type of bias and what sort of things are you expecting to see? So with recall bias, participants are having a hard time remembering how something went. Maybe within the study, there's a comparison of patient experience with their objective health records, or maybe patients keep a diary so that helps to limit recall bias, or things along those lines. So you want to look for that kind of consideration in the reporting of the study. So when you're looking at a quantitative paper, you want to say, is there, in the methods section, is there a conversation of reliability, validity, and an acknowledgement of bias? Now, you can't always do something about every potential threat to the quality of your study, but you want to know that they've thought about it and that they've acknowledged places where there are limitations. So when you have authors that acknowledge the limitations up front, that shows, to me, that study is a lot more credible than if they pretend they're not there. So within the different types of quantitative papers, there's something called CASP tools, which I'm going to talk about a bit in the next video. So it's critical appraisal skills program, and you can use those tools to look more specifically at a research method, so that you're getting, the difference in like a descriptive cohort, or descriptive cross-sectional design versus a randomized controlled trial. Make sure you're looking for the right things there. So that's an overview of reliability, validity, and bias. And in the next video, we're going to look at rigor in qualitative research.